Now, a deadly diphtheria outbreak is raising fresh concerns in Kano State, with lawmakers saying more than 50 children have died in Rano Local Government Area. The Kano State House of Assembly is calling for an urgent government response as diphtheria spreads through communities in Rano and neighbouring areas. Lawmakers say the outbreak has been particularly severe in Ridin and Sabuwar Kaura, while cases have also been reported in parts of Kiru. They're demanding more emergency medical support, vaccination and preventative measures to contain the disease. The warning comes a year after a similar outbreak reportedly claimed several lives in the area. The Assembly has now directed its Health Committee to engage the Ministry of Health and Emergency Relief and implementation of measures under the state's health protection law. News Central's correspondent Stephen Enoch is joining us now live from Kano to talk about what he's discovered since. Enoch, it's good to have you here. Thank you for joining. This is clearly a worrying development, particularly with children reportedly bearing the brunt of the outbreak. Enoch, what exactly have you found out?
So this outbreak is not something new that has happened, but the death toll is something that is, quite worrying, as you have mentioned. It has happened in, Kiru local government as well too, Rano local government, and also Dangora as well too. And one thing I want to note is that, sometimes when this disease, breaks out in some of these communities, they do not report it on time because, sometimes they go to some traditional medicine doctors that they also refer to as Wanzame. And, when diphtheria happens, we have this, thick white substance, inside behind the thumb, just around the area of the throat and nostrils. And then some of these men, they use a blade to cut it out, and they use some kind of scissors to cut it out, hoping that the children have been cured from the diphtheria. So, and diphtheria is something that's contagious. So they go there, do what they want to do, and then these children still interact with others in the community. And mind you, some of these communities, they have one source of water, and it's like everybody knows everybody there. So these children mix with other children in the communities, and that is how this keeps spreading and spreading. And there was a time when I went to one of the local government areas and see how they mingle among themselves, and it's something that's concerning, because I believe that the spread of this diphtheria would have been curtailed if maybe what had been sent to the health authorities. I called the Ministry of Environment, trying to hear what they have to say about this outbreak, but no response from them. After now, I'll go to the Ministry of Health to see if I can get anyone to speak before going to Rano to get a clear picture of what has happened there and the actual number of the deaths, because sometimes you hear 50 and it could be more or less. So that's what I've got for you, Ms.
But beyond the figures we're hearing from the Assembly, what are health officials and residents telling you about how the outbreak is affecting these communities?
Well, the health officials haven't spoken yet, no press statements. Even when I called them, no one picked my call, no one responded to my text message. And maybe they are planning for a press conference later, but people are scared because this particular disease is contagious and is spreading across many children. So people are concerned about the fact that, okay, has my child caught this infection, or what am I to do next? So people are a bit apprehensive about it, and people are trying to see how they can prevent their children from getting this disease, because of course, in the holiday period, we have so many children at home and they mingle with so many of their friends, and you can't stop children from playing around. So people are apprehensive at the moment. They're trying to see how they can protect their children from getting diphtheria, and seeking health, any guide from health authorities. That's what they are doing at the moment.
Oh, thank you very much, Stephen. Enoch will continue to come back to you for more on this. Thank you.